Hi, Dr. Buttler here. Thank you so much for taking the time to learn more about your health today. I was motivated by one of my patients to do a video, kind of a short video here, on just the purpose and understanding of why I ask my patients to do what they do with regards to their self-care and with regards to the routine that we work on a day-to-day basis. Oftentimes the routine that I ask my patients to do can be requiring of a lot of time, a lot of effort, a lot of energy, sometimes sacrifice, but an understanding of the importance of that and the reasoning behind why we make the choices that we do on a daily basis and how that pertains and how that plays into how we feel, our ability to heal, our ability to function optimally. This idea of optimal health is what we are after. I feel it. I have patients that feel it. I know it's attainable. Way too often in our world we assume that as we age, as we get older, that we just are, kind of designed to succumb to chronic illness, to chronic pain, to fatigue, to states of insomnia, and that obviously is happening for lots of people, but that is not the design. The design of the human physiology is to, in truth, improve with age. Now, that does not mean that your ability to do everything that you could do when you were a 20-year-old, or this idea of beating the aging process. That's not what I'm talking about. I'm talking about the efficiency of the system, the efficiencies of your physiologic function are designed to improve as you age so that you can age gracefully, so that you can be autonomous, you can take care of yourself, you can do the things that you want to do as you move into what I like to think about is our better years. And this is why we do our self-care, why we do conscious breathing, 10 breaths every hour throughout the day, why we hydrate our bodies with water through the day, why we move through the day, purposeful movement, why we go to bed at an hour that is consistent with hormone function, the circadian rhythm, why we focus on the importance of sleep hygiene, and why we do elimination therapeutics such as castor oil packs, hydrotherapy, dry skin brushing. We do things like oil pulling. All of those therapies up to that point are designed to create motion and movement in the body. I like to say movement is life, stagnation is death. When things become too stagnant in our bodies function, things build up, things accumulate. Through accumulation comes a lack of function. Just think if your house gets too accumulated, you get too much stuff in your house, things just don't work as well. Things have to be moving. We need to be supporting that movement, that detoxification, the elimination. Then we also have to be attentive to what we're bringing in, not just getting rid of, but what's coming in. This is where nutrition is so crucial when it comes to our health, that the choices that we make on a day-to-day basis, that ties into our the food that we bring into our body, this concept of letting our food be our medicine, really working to reduce the accumulation of inflammation that comes from food choice. I often see with a lot of my patients, we want to second guess that. We want to try to find a workaround with regards to being able to continue to do the same things that we enjoy, but get a different result. And unfortunately, you have to change if you want change to happen. You have to be attentive and aware of the choices that you make and what you're bringing into your body to give you the possibility to heal. And this occurs over time. Time is the other important part of medicine that we don't really discuss a lot with our patients. We assume that the quick fix is available. We assume that the medication or the pill will make it better, and you can continue to keep on doing what you want to do, just based on based on pleasure. And you can, life can be pleasurable, but we want to feel good. We want to use our home therapeutics. We want to use our nutrition. We want to use our supplementation. Remember, your supplementation that you use is a very important part of your health care. It gives you stability. It gives you resources and tools that are used to help your body better function as you're working on detoxification, as you're working on your lifestyle, as you're working on moving towards that state of potential that is there. There's a capacity within your body, and it wants to get there, and you want to get there. It's just the obstacles that present for us through our lives that oftentimes move us one way or the other. And I like to talk to my patients about, if you get outside your margin, there's always the next opportunity or the next choice to get back into your margin and learn what it feels like to feel good. And it can be, it can be effort to do that, but it's well worth the effort. It's worth the sacrifice. It's worth the time and the energy. It's worth showing up to work on your health. Health is not a passive, you can't be a passive participant in your health. You have to be an active participant in your health if you want to have the level of health that I believe that you deserve, and you're worth it. So keep working your routines. Keep working on your lifestyle. Keep working on your belief systems, on detaching, on being engaged and bonding in with people in your life and the relationships in your life, but detaching from what you do not have control over. Be working to stay in the present. Don't get far outside the moment. Your best work is now, and staying focused with what you have control over now. All of that wrapped together and put together is an environment that allows for healing to take place, for optimal function to take place, and really what I believe is to elevate ourselves as human beings, to elevate our soul, our spirits, in an effort to give back to one another through our actions, and be able to spread more love versus fear, which is happening too often these days, and contributing to what I believe is the demise of our functional capacity. We're retracting, we're not expanding, we're accumulating, we're not eliminating, and this is becoming an issue as it eventually shows up as chronic illness and disease. But the opportunity is now. Every day you have a new opportunity to be working on your self-care, be working on your health, and I know you can do it, and you're worth it. And again, I want to thank you for taking the time to learn more about your health today. Thank you.